Hi everyone, mag-usap na naman tayo about skincare, and as you can see, special na naman ang set natin ngayon because we're going to be talking about a topic that requires derma answers. And as you can see, meron akong kasama na dermatologist today, the very pretty Doc Bea. Hello, Doc Bea.
Hi everyone! Palakpakan naman kayo dyan!
So I brought Doc Bea here because we're going to be talking about a topic na medyo wala akong experience sa kanya personally. It's melasma. Ito kasi I think yung Tagalog niya, Doc, is PEKAS. Problem siya ng maraming Filipino. Kasi diba, Doc, it's a form of hyperpigmentation. So may relation siya ng konti to dark spots. Medyo magdi-deep dive tayo sa topic na to and Doc will let us know kung ano yung mga specifics that we have to know about the skin condition. So diba, na-establish nga natin na form siya of hyperpigmentation. So for those who don't know, yung hyperpigmentation, maraming iba't ibang kinds of hyperpigmentation. Yung mga dark spots natin, yung mga age spots. How different is melasma from those other conditions, yung mga ibang hyperpigmentation sa skin?
Yung hyperpigmentation kasi, para siyang broad term. It encompasses any dark discoloration or brown or dark spots sa skin natin. We view hyperpigmentation as deposition of excess melanin sa balat natin. Ito yung pigment na responsible for the color of our skin, sa eyes, and
Yung reason kung bakit nagda-dark yung skin natin.
Yes, oo. But it's also a form of protection against UV rays. Kaya, compared to Caucasians, we are less likely to develop skin cancer. So, hindi naman siya pangit na bagay. I guess what sets melasma apart from all the other types of hyperpigmentation is yung reason kung bakit nagkakaroon ng excess melanin production. Kasi when we talk about melasma, actually we can diagnose it based on physical findings alone. It's very distinct yung characteristic niya. So you usually develop brown patches sa forehead, sa nose, sa upper lip, sa chin, and even sa cheeks. But actually, the most common would be yung centrofacial.
Dito.
Yeah. So it would involve your forehead, nose, upper lip, and chin. Or pwedeng mix. It has to be diagnosed by an expert. In residency, we actually train yung clinical eye. So para pag isang tingin lang, ay, alam ko na yan. Oo, parang galing. Nakalagay talaga na 50% or 1 out of 2 patients with melasma may positive family history. So, when we say positive family history, kasi pwedeng meron kang kamag-anak, it could be your mom, your tita, your lola, your pinsan, basta kamag-anak mo that has the exact same condition. And then, of course, syempre tayo, as Filipinos, we get exposed to a lot of
Sun exposure, di ba?
Oo, it's summer all year round. Kaya naman talaga, we get higher UV exposure and it makes us more predisposed to develop the condition. So, tama yung environment and genetics. One of the major reasons would also be race. So, for example, Southeast Asians, and then aside from that, even yung mga Africans, African Americans, or Latin Americans, people with darker skin color are predisposed to develop these types of conditions, such as melasma, kasi we produce more melanin. A lot of Filipinos, they love using lightening products, but they forget to wear sunscreen. So parang it's
Wala ring effect.
Oo, diba? Very important rin talaga yung shade, like umbrella.
Yung physical, Doc, na sun protection, di ba?
Yes, and then yung mga clothing. I guess most patients do not know na most whitening products or yung bleaching products are actually known irritants. For example, ang pinakasikat, diba, would be kojic acid.
Kojic acid.
Oh. Pero just to clarify, I'm not against kojic acid, but I seldom recommend it for the face or thin skin areas like the neck, sa groin, armpits. Parang hindi siya for that purpose. I recommend it for elbows, knees, yung mga thick skin areas. So now, when you use lightening products and if you don't wear sunscreen, or if talaga nagpabilad ka sa araw ng tanghaling tapat, pwede kasing may tinatawag na rebound hyperpigmentation. So rebound hyperpigmentation is basically when your skin encounters trauma, pwedeng in the form of irritation, yun na nga, sa cosmetics, pwede rin in the form of heat, sa laser, your skin produces more melanin as a form of protection. So minsan nagtataka yung patients, parang instead na pumuti, bakit lalong nangitim?
Kasi na-irritate.
Yeah, irritate, or sometimes, like for example, laser whitening services.
Yes.
Sobrang init, the heat actually can also trigger rebound hyperpigmentation.
I see. What do you think are some things that, or some skincare products that people with melasma should generally be careful in using?
Honestly, melasma kasi it's a very difficult condition to treat. So I think hindi siya more of the problem is the skincare products. Sa akin, it's the condition eh. Oh, it's a very delicate condition na pag nag-misstep ka, pwedeng mas umitim. So, I would want you guys to be guided na from day one. Huwag ka nang mag-DIY.
Huwag ka na mag-experiment with different skincare products.
Yes, kasi, di ba, well, ang inisip ng mga tao, the worst thing that could happen, hindi siya gagana. Not true. The worst thing that could happen, mas umitif pa siya. Di ba? Which we don't want to happen.
Are there other causes or factors na feeling mo hindi masyadong aware yung mga tao that you feel na dapat mas maging aware sila?
Yes, so hormones, 9 out of 10 patients with melasma are women. Usually in the range of 20 to 50 years old. So premenopausal siya. And then hormonal changes like pregnancy and intake of oral contraceptive pills nakaka-affect it. When you get pregnant, mas talagang your hormones goes into overdrive. Diba? Kaya nga diba yung mga pregnant females, minsan emotional, alam mo yan, roller coaster of emotions talaga. But basically, the exact pathophysiology or what causes yung excess melanin deposition, hindi talaga siya understood. So there are a lot of factors that comes into play, but yung pagkasunod-sunod niya, hindi pa rin nila maintindihan.
Ang mga ina-address natin, these are different factors that contribute to melasma, pero yung main talaga, hindi pa siya sobrang known.
Yeah.
So now that we're touching on yung treatment, Doc, ano ba siya usually? Kasi as someone na hindi masyadong aware sa melasma, is it something na topical treatments ka muna? Or may mga procedures ka muna? Or is it a mix of both? Kasi diba sabi mo ng Doc, very complicated talaga or very complex talaga yung pag-treat ng melasma. So, how do dermatologists usually go about it?
Multimodal approach talaga siya. So it's
Ano multimodal? Sorry, multimodal.
So it's a combination of topical treatments and your procedures and even oral treatments. So like with me, aminin naman natin here sa Pilipinas, talagang mahirap ang buhay. So for my patients, sometimes if they can't afford procedures, I tell them, okay lang, you can lugi. I mean, you can still do the topical therapy. It's just that the results might take a longer time, diba? Parang hindi siya as fast as you would want if talagang multimodal yung approach mo. Now, when it comes to lightening products, ganun pa rin. So it's simply your tyrosinase inhibitors pa rin, your azelaic acid, vitamin C, niacinamide, arbutin. Actually, the gold standard treatment would still be your 4% hydroquinone. Alam mo, yung hydroquinone, sikat na sikat yan here. Diba? It's common ingredient sa Rejuve. But, marami siyang side effects talaga. One of which would be your exogenous ochronosis. So it's usually blue-black patches of discoloration sa face and it's irreversible. Yun yung mahirap talagang i-treat. If melasma is hard to treat, yun talagang parang, near impossible. Ganun siya kahirap. So that happens when you misuse yung hydroquinone or if you don't know how to use a hydroquinone the right way, kaya important na you're guided. It's a combination of topical lightening agents kasi. I do combination din. I use azelaic, Tret, vitamin C, glycolic acids. I use a lot. And then, ito yung hindi masyado alam ng patients. You can actually take oral tranexamic acid for it. So basically, tranexamic acid, kasi melasma is a vascular component.
Vascular yung ugat-ugat yung Doc.
Yes, oo. Pero yun nga, hindi pa rin talaga nila ma-explain how it comes into play, lahat ng factors na we mentioned a while ago. So tranexamic acid addresses that.
So if it's melasma na parang may ugat-ugat, if you take tranexamic acid, it can help with.
Well, actually, it can't be seen by the naked eye. It's more of sa dermoscopy, gano'n, na ma-notice natin na mayroon siyang mga vascular aspects. So, baka kasi yung mga patients maghanap sila ng literal or, alam mo yun, visible na blood vessels. Walang gano'n. But, most melasma have promising results with oral tranexamic acid. 12 weeks lang yung maximum na sa study na recommended
Okay. Take it lang for 12 weeks and then pwede ka na mag...
But then, wala pa rin siyang study na when it will come back. So I guess, it won't. Kasi yun,
Because it won't.
yun na diba?
I guess it's worth a try kasi meron na ring mga data that it's effective.
The lesson here is, of course, you have to take it for 12 weeks to boost lang yung results. Para makita mo agad yung results and then afterwards, you can continue with topical therapy.
So bagay do kasi nga minention mo na multimodal siya or parang iba't ibang ways to treat yung melasma. So parang kumbaga isang angle lang siya pero may iba ka pang mga treatments na isasama. How about yung lifestyle, Doc? Meron bang mga habits na nakakatulong in maybe preventing it or maybe helping your melasma get better? Meron bang mga habits na ganun?
Yung diet, hindi masyado factor. No? Yung food, hindi siya, like, you don't eat, well, good thing yun for them, di ba? Wala siyang iwasang food. But for lifestyle, one of the things that surprised me, meron akong patient na baker. She is very young, but then, exposure to the heat from the oven, nakapag-trigger rin ng melasma niya. She was very young. She was younger than me. When I get patients na with melasma, especially mga mommies, marami akong ganun, mommies, lolas, I tell them, naku, huwag ka masyadong magbabawad dun sa harap ng stove. Oo, kasi it could also trigger or it could also worsen. Kasi yung heat din yun eh.
When it comes to having a skincare routine kapag meron kang melasma. So of course, sabi mo, Doc, di ba? Very important na meron ka ng treatments talaga. Yun yung number one. If you already have melasma, it's best to get a very tailored na treatment para sa'yo. Kasi iba-iba din ating mga types of melasma, iba-iba din yung mga treatments, iba-iba yung mga mas factors na nangingibabaw para sa'yo. But when it comes to a skincare routine that supports your treatments, what are some recommendations that you have na hahanapin ng mga tao sa skincare products nila or dapat nilang hanapin sa mga skincare products nila?
Depende sa lifestyle ng patients. Ina-assess ko also. And of course, the budget.
Yes.
Diba? But what is essential for me would be your mineral sunscreen. Your physical filters, mga zinc oxide, titanium dioxide, especially iron oxide, they provide broad spectrum protection kasi. And then, maganda pa dyan, safe siya for all skin types. Even those with sensitive skin. And even for those pregnant or breastfeeding.
When it comes to mineral sunscreens, yung mga may zinc oxide, titanium dioxide, for me kasi, Doc, mineral sunscreens na mineral that tend to, minsan may nafe-feel ako ng hapde, maybe because they have essential oils.
Ideally, mineral sunscreens are developed for those with sensitive skin types. So ideally, dapat wala siyang mga fragrance. Kasi yun talaga yung target market nila eh. Aside from sensitive skin types, I think besides the protection, it's the risk for irritation or allergic reaction. For some people, hindi naman generalized. For some.
Many of the factors add up.
Yeah.
But I guess, it's something that needs to be developed more sa industry natin, no? Kasi parang, ilan pa lang, mabibilang ko pa lang sa kamay ko yung mga mineral sunscreens. In fairness, meron ng ilang mga local brands natin na nagsi-step up, giving us more mineral or kung hindi man fully mineral, parang sensitive skin friendly na mga formulas na meron pa ring mga mineral filled eh. So I guess that is still a step in the right direction. When it comes to ingredients, Doc, na mga lightening or brightening sa skin na nakakatulong din in a way sa melasma.
Hindi mawawala sa routine ko would be azalate, tretinoin, glycolic, and niacinamide. It's actually a mix of prescription, which is your tretinoin and azalate, with a mix of your over-the-counter, like mga niacinamide, glycolic acid, vitamin C. But then your derms could also prescribe you something different. Kasi ganyan kami. Siyempre for derms, it's a matter of applying what you know, yung knowledge mo, and kanya-kanyang strategy or something.
Yes. Kumbaga you have your favorite ingredients that have worked for you and sa mga patients mo.
Yeah.
Paano siya na-integrate into a routine without causing the irritation sa skin?
You have to use a good moisturizer para ma-reinforce and strengthen yung skin barrier. So very important ang moisturizer.
Since moisturizer is more of like parang very tailored siya based on kung gaano ka oily or ka-dry yung skin type. Mas specific ba siya to a certain skin type like oily or dry?
Ganong question pero actually wala akong naalala na nabasa na studies about it. In my practice, most of my patients are dry. Could be the age also.
Could be the age kasi nga medyo mas mature na yung nagkakaroon ng melasma.
Yeah. And actually, when you combine a lot of these skincare actives sometimes it makes your skin dry, diba? Like,
Yes.
for example, tretinoin, it makes your skin dry.
For you, Doc, what are some ingredients in moisturizers na pag nakita mo ay mukhang okay to? Or some ingredients that you like to tell your patients na maghanap ka ng moisturizer na merong ganitong mga ingredients? Or bibigyan mo sila ng moisturizer na merong ganitong mga ingredients?
When it comes to reinforcing your skin barrier or repairing any skin barrier damage, you go for emollients such as ceramides or squalane. Actually, most moisturizers, they contain emollients, tsaka humectants.
How about yung mga clinical procedures, Doc, for melasma? Because all I know is laser therapy. What are some options that people have for melasma? We know that laser in general, hindi naman siya mura, hindi naman siya affordable by any means. But what are the most accessible, I guess, na mga treatments sa mga maybe nakapag-save up?
NDIAG laser, so uses 1064 nanometer wavelength. Wow! Very scientific.
And yeah, yung mga rev light.
Yes, yung sa NDIAG kasi, it's the category of lasers and then different brands yan. For NDIAG lasers, it can target pigments, it can target vascular lesions, so swak na swak siya for melasma. But then, based on my personal experience, it should be still combined with topical treatments. Otherwise, sayang. Kasi the laser treatments wouldn't work as efficiently. I-clarify rin natin na, I get patients na have this misconception that laser procedures, punta ko here, I'll spend, let's say, 10,000 pesos. Dapat may result, but most laser procedures, it actually takes at least 3 sessions before you see any visible result. Ang laki na nun for most, diba? I tell them it's more of a lifestyle, the laser procedures. Kasi they have this concept na parang, alam mo yung meron kang bukol ko right here and then papa-opera mo, tanggal na, okay na, one time lang.
Kala nila ganon.
Yeah.
Pero lasers are more of like continuous mo siyang ginagawa.
Yeah.
So I guess it's not so much the budget-friendly option for those na nagtitipid, but it can help. Okay na talaga. Now, speaking of budget, Doc, kasi may mga iba, ginagawa nila is DIY.
Yeah.
Na parang, okay, gagamit sila ng yogurt. Some of them use lemon. So, kasi alam na natin na hindi talaga the best ang mga DIY treatments. But what could be some dangers that might happen kapag pinagpatuloy natin yung ganito na treatment pa for something as complex as melasma?
I think kasi most of them think na if you do DIY treatments, diba, parang mas makakatipid ka.
Yes.
Pero, if you develop side effect, mas papatong pa yun. Actually, for example, ganitong shade lang siya and then may ginawa ka, masayang nangitim, ganitong shade na. So, it will take a harder time for your doctor to repair not just your skin, but also to reverse yung damages na nangyari because of your DIY treatments. So I think it's more of going to an expert for guidance and yung tamang way to treat your condition. Because sometimes they also self-diagnose. Tapos mali.
Tapos mali. Ibang condition pala, so lalong dumagdag lang yung gastos mo. Yeah, this is a common thing na narinig natin sa mga dermatologists na instead of tinanay mong tipirin siya ngayon, i-address mo na lang siya ngayon because more gastos pa siya later. So namin nasa topic na tayo, Doc, of budget. What would be something that you would recommend na i-prioritize nila? For example, pag take yung melasma and magko-consulta with a dermatologist.
You have to have an open communication with your derms. Kasi if you set the budget, for sure we'll adjust. Alam mo, I get patients na they come to me immediately after a consult with another derm because they were prescribed with products na mabato ng 10,000 pesos. And then I told them, sabi ko, why didn't you tell her? I mean, I'm sure if she knows, she'll adjust. Diba? Kasi sometimes nahihiya. But yung burden na mag-adjust, nasa sa amin naman talaga. Because we wanted to treat you also. Yun naman yun. At the end of the day, we have to prescribe something that you'll be able to use consistently so that it will produce an effect. For example, if may binigay ka sa aking price point, I'll choose kung ano yung favorite or ano yung most appropriate skincare actives for you that will elicit a result. But then, you also have to set realistic expectations.
Na parang since hindi mo nga magagawa yung lahat, medyo mas slow yung progress, diba?
Oo. Ano naman yun? Slowly but surely.
At least meron, at least step forward siya.
Ako rin, naniniwala ako sa gano'n na, any progress is still progress.
It's still progress, diba? Kahit mabagal, at least bumagaling siya through time, diba?
Yeah, o kahit it takes years, diba, alam mo yun. But then, some patients, they get discouraged kasi. So I tell them, what you do is, you take a picture, say day 0, before any procedure, and then you take another picture after a month. Hindi naman ako daily. Medyo mahirap yun. Pero, you take a picture after a month, for sure may difference yan. Kasi same lighting, same angle, you have to find ways to encourage yourself. Kasi kahit anong sabihin mo, if they feel na it's not improving, diba? Hindi mo sila maniniwala also say.
True. Kailangan i-track talaga nila sa sarili nila yung progress. And of course, dapat consistent din sila with the treatments that the dermatologist gave them, diba?
You have to start somewhere. Most patients, they feel intimidated or they feel discouraged. Wala pa nga. Diba? Baka narinig nila, melasma, hard to treat. Wag na lang.
Ang maghanap na lang ako ng kung ano-anong mag-work.
Yeah. But you have to start somewhere, especially if it's affecting your mental health, your confidence. You know, if it's something that can make you happier, why not go for it?
This was super informative even for me kasi yun nga, wala akong experience at all. But I hope this is very informative to you guys, especially yung mga nanonood na matagal na nilang nire-request talaga ang melasma. Doc Bea, thank you so much.
Thank you.
If you want to consult with Doc Bea, ilalagay ko na lang information below where you can find her or where you can consult with her. And also, sa social media naman, Doc, where can we find you on social media?
Yeah, so you can follow me on TikTok at Bea Maxine MD, and then Instagram, Bea Maxine Chan.
Alright, so ayun na siya guys. Thank you so much for watching and let us know or let me know in the comments kung ano pang mga topics ang gusto niyo pag-usapan ko with a dermatologist. But for now, here are some other videos that you might want to watch, point ka dito, Doc, with other dermatologists that I featured in this channel. Kung gusto niyo pang si Doc Bea ulit bumalik sa channel, just let us know in the comments. But for now, we will see you in the next video. Bye!
Bye!